A recent study published by researchers in CU Anschutz says individuals living near oil and gas wells could be at higher risk of cancer and other health issues than their neighbors further away.
Present Colorado regulations say oil and gas wells can be no closer than 500 feet into residential constructions, a distance that might not be far enough to stop damaging health consequences, according to a press release from Boulder County.
The CU study published in the journal Environmental Science and Technology found that the cancer risk for people living within 500 feet of an oil and gas facility is 8 times higher than the Environmental Protection Agency's upper risk threshold.
The EPA sets air quality thresholds for various air pollutants, including those created by drilling. As far as the pollutants that come from oil and gas wells, those are supposed to have a lifetime cancer risk estimate of 1 in 10,000.
The CU study says the risk is actually 8.3 in 10,000 for those within 500 feet of wells.
These findings indicate that state and federal regulator policies may not be protective of health for populations residing near oil and gas facilities, reads the abstract to the CU study.
There are other health risks besides cancer covered in the study, including neurological hazards, blood and bone marrow hazards, and developmental health effects for those living 500 feet or closer to a well.
The study's lead author, Dr. Lisa McKenzie of the Colorado School of Health, says that their previous work shows thousands of people living along the Front Range live 500 feet or closer to an oil and gas well.
Our results suggest that Colorado's current regulations that specify a 500-foot distance between a newly drilled oil and gas well and an existing home may not protect people from exposures to hazardous air pollutants that could impact their health, she says in a release from the school. This new study focused on how poor the air quality nearest to the well is compared to, in some cases, more than a mile away. For one pollutant researchers tracked, the intensity was 41 times higher within 500 feet of the well than for those a mile away.
The study provides further evidence that people living close to oil and gas facilities are at the greatest risk of acute and chronic health issues due to air pollutants emitted by those facilities, said Pam Milmo, Boulder County Public Health Air Quality Program Coordinator, in a press release.
Researchers say they looked at more factors than other studies have in the past, including nighttime emissions, which are worse due to what the study's authors say is high atmospheric stability at night.
The study does point out the need for more research into this subject and continued uncertainties when it comes to those living close to these wells.
CU Anschutz researchers worked with NASA, CU Boulder, Boulder County Public Health and the University of Colorado Irvine in this study.